Welcome back to the channel, folks. Dr. Sharma here, board-certified psychiatrist and Air Force veteran. As always, I wanted to mention that this video is for informational purposes only. It is not medical or psychiatric advice. Please discuss your individual symptoms with your physician, provider, or therapist. I write independent medical opinions or nexus letters for veterans, and one of the most common questions I get is whether or not irritable bowel syndrome or IBS can be caused by anxiety. I think this is a great question and topic within mental health, so let's dive in. IBS is a common gastrointestinal disorder and it affects a lot of veterans. There is a lot of evidence that shows anxiety leads to the development and worsening of IBS symptoms. I will have the studies referenced here in the description for the video. First of all, what is IBS? The condition comes with a lot of different symptoms, and it includes abdominal cramping or pain, diarrhea, constipation or both, sometimes nausea, vomiting, also bloating, and flatulence or gassiness, and more symptoms. It's estimated that in the general population, there are between 5 and 10% of people with IBS. This brings me to what we call the brain-gut connection. A little known fact is that our gut actually has more neurons than the brain of a cat. Our brain and gut are in constant communication. Stress has a huge impact on our digestive system, and studies have actually shown that IBS-related changes include inflammation, immune responses, and even changes in the gut microbiome. That's right, the actual gut bacteria changes because of IBS, and this has been shown by scientific studies. There have been recent studies suggesting that IBS and anxiety share some similar genetic pathways. There obviously needs to be a lot more done on this area in terms of research, but it's interesting and it's in the beginning phases. One thing I wanted to mention is certainly there's a connection between anxiety and IBS, but we also have to remember that anxiety is a part of a lot of mental health conditions. For instance, PTSD often comes with a great deal of anxiety. Similarly, depression can be associated with some pretty strong anxious features. So these conditions can also cause IBS because of the anxiety itself. The studies linking PTSD and IBS are very strong in particular, and a lot of the studies are actually based on U.S. military veterans. Going a little bit deeper into the studies, they've also shown that anxiety leads to what they call motility disturbances, which just means changes in how food is actually processed in the gut and how fast it's processed. It has also shown what they call visceral hypersensitivity, which means that the gastrointestinal organs are actually more sensitive, which probably causes the increased pain and cramping that people experience in IBS. Serotonin dysregulation is also another factor in IBS. They've shown this as well. The concentration of serotonin in the plasma is actually reduced in IBS patients. And remember, serotonin has a prominent role in anxiety and depression. That's why depression and anxiety medications are based on serotonin. Getting back to veterans, it's also interesting that IBS is technically a presumptive illness if someone was deployed to Southwest Asia or the Middle East. This means that if someone has IBS and was deployed to that area, provided that the symptoms first came about during the deployment or by 2016, then it is presumed that the condition is related to the deployment. That is pretty significant, and it means that IBS might be related to the exposures while deployed. What are those exposures? That part is not completely clear right now, but it's interesting and more research and evidence should be coming out in the future. I also wanted to mention that in IBS, a colonoscopy will be normal. That is because the condition is inherently neurological, right, and internal to the GI tract. It involves the neurons which we can't see. So the colonoscopy will actually show a normal colon. Although a colonoscopy is not technically required to diagnose IBS, it is usually done to rule out other causes of the symptoms like inflammatory bowel diseases. That includes things like Crohn's disease and ulcerative colitis. So your physician might still order a colonoscopy based on your symptoms. But again, if it's normal, you may still have IBS. What about treatment? Of course, the best thing to do is to get to the root cause of the condition. So if we think that the anxiety is causing IBS, in your case, for instance, you want to target the root cause, which is the anxiety itself. So managing stress, anxiety symptoms through therapy, lifestyle changes, relaxation techniques, things like that will be extremely helpful. You also want to look at your diet. What might be causing this irritation in your GI tract, and how can you improve what you eat? This could involve a food log, right? A food diary, which can be tedious, but you're writing down the times of the day, which days of the week, what you're eating, and your symptoms, and you can start to identify what specific ingredients or foods are giving you that irritation. There is also cognitive behavioral therapy for IBS, especially if it's linked to mental health symptoms. This focuses on the thoughts and behaviors associated with IBS. This basically combines ways to change your thought patterns, exposure, and also includes stress management and mindfulness. That's it for today's video. I hope this was helpful for you to take a deeper look at IBS and how it relates to anxiety and other mental health conditions. This, I think, is especially relevant to veterans. As always, thanks for watching. Dr. Sharma signing off. See you next time.